Ever wonder why high blood pressure is often called the silent killer? It's because it can quietly damage your body for years without any noticeable symptoms. But the good news: understanding its causes and knowing how to prevent it can make all the difference. Before we dive in, don't forget to like this video and subscribe for more insights on health and wellness. Let's explore what leads to high blood pressure and how you can keep it in check. 1. What is high blood pressure and why it matters? High blood pressure, or hypertension, is a condition where the force of blood pushing through your arteries remains consistently too high. This elevated pressure puts extra strain on your blood vessels and vital organs, especially the heart, brain, kidneys, and eyes. The condition is often called the silent killer because it rarely shows clear symptoms until significant damage has already occurred. When untreated, hypertension increases your risk of heart attacks, strokes, kidney failure, and even vision loss. It gradually wears down the inner linings of arteries, causing them to harden and narrow, limiting blood flow. This forces your heart to work harder, which can eventually lead to heart failure or arrhythmias. What makes it dangerous is how quietly it develops, often going unnoticed for years. 2. Major causes and risk factors of hypertension. High blood pressure can stem from a variety of causes, often involving both genetic predispositions and lifestyle choices. Primary hypertension, the most common type, usually develops gradually over years without a specific identifiable cause, but it's strongly influenced by age, heredity, and general health habits. Secondary hypertension, on the other hand, is caused by underlying conditions like kidney disease, thyroid problems, or the use of certain medications such as birth control pills or decongestants. One of the biggest contributors is a high-sodium diet, which causes the body to retain fluid and increases pressure within the arteries. Lack of physical activity and sedentary habits also elevate risk, as they contribute to weight gain and weakened heart function. Being overweight or obese forces the heart to pump harder, raising blood pressure consistently. 3. The role of diet in preventing high blood pressure. What you eat has a profound impact on your blood pressure, making diet one of the most powerful tools for prevention. High-sodium diets are among the biggest dietary contributors to hypertension, as salt causes the body to retain water, thereby increasing blood volume and pressure. Reducing salt intake is often the first recommendation doctors make for those at risk of high blood pressure. Processed and packaged foods tend to be salt-heavy, even if they don't taste salty, so label reading is essential. On the flip side, a diet rich in potassium, magnesium, calcium, and fiber can naturally help lower blood pressure levels. Limiting red meats, sugars, and processed snacks is also crucial, as these contribute to both weight gain and artery damage. Hydration plays a key role too. Drinking plenty of water helps maintain fluid balance and kidney health. 4. Lifestyle changes that lower blood pressure naturally. Making intentional changes to your daily routine can significantly lower blood pressure and improve heart health. Regular physical activity is one of the most effective natural remedies. Aiming for at least 30 minutes of moderate exercise most days of the week can strengthen the heart and improve circulation. Activities like walking, swimming, cycling, or even dancing are excellent choices that can be easily incorporated into daily life. Maintaining a healthy weight is another crucial step, as excess weight puts more strain on the heart and arteries. Even small weight losses of 5 to 10% of your body weight can make a significant difference in blood pressure levels. Managing stress is equally important. Chronic stress triggers hormonal changes that keep blood pressure elevated over time. Techniques such as deep breathing, meditation, yoga, or spending time in nature can calm the nervous system and support heart health. 5. Importance of monitoring and medical support. Regular monitoring of your blood pressure is crucial for early detection and effective management of hypertension. Many people are unaware they have high blood pressure until a routine checkup or a serious event like a stroke reveals it. Home monitoring tools have made it easier than ever to track your blood pressure consistently and share results with your healthcare provider. Catching elevated readings early allows for quicker intervention and prevents long-term damage. While lifestyle changes can have a powerful impact, medical treatment is sometimes necessary to keep blood pressure within a safe range. There are several classes of medications such as diuretics, AC inhibitors, beta blockers, and calcium channel blockers, each working in different ways to reduce pressure on the arteries. 6. The connection between stress and blood pressure. Chronic stress is a significant but often underestimated contributor to high blood pressure. When you experience stress, your body responds by releasing hormones like adrenaline and cortisol that temporarily raise your heart rate and blood pressure as part of the fight-or-flight response. While this is helpful in emergencies, constant exposure to stress causes these hormones to stay elevated longer than necessary, putting continuous pressure on your cardiovascular system. Over time, this leads to inflamed blood vessels, increased heart workload, and a higher risk of hypertension. People under chronic stress may also adopt unhealthy coping mechanisms such as overeating, smoking, excessive drinking, or avoiding exercise, which further increase blood pressure risk. 7. The dangers of ignoring early warning signs. High blood pressure rarely causes symptoms in its early stages, which is why it often goes unnoticed for years. However, some subtle signs may serve as early red flags, such as frequent headaches, blurred vision, dizziness, or shortness of breath. These symptoms are easy to dismiss or attribute to stress, fatigue, or aging, but when persistent, they should not be ignored. Some people may experience nosebleeds, chest discomfort, or difficulty concentrating, all of which could signal elevated pressure. Unfortunately, waiting for symptoms to appear can be dangerous, as by the time they're noticeable, damage to the arteries or organs may already be underway. That's why routine blood pressure screenings are essential, especially for people over 40 or those with a family history of hypertension. 8. How sleep quality affects your blood pressure. Sleep is more than rest. It plays a direct role in cardiovascular health and blood pressure regulation. Poor sleep or chronic sleep deprivation can lead to increased levels of stress hormones that raise blood pressure. Studies have shown that people who get less than 6 hours of quality sleep consistently are at significantly higher risk for hypertension. One major sleep-related condition, obstructive sleep apnea, causes breathing to stop and start repeatedly during sleep, leading to drops in oxygen levels and spikes in blood pressure throughout the night. These fluctuations not only damage blood vessels, but also increase strain on the heart over time. Sleep apnea often goes undiagnosed because many people are unaware of their symptoms, such as loud snoring or morning fatigue. 9. Physical inactivity and sedentary habits. Living a sedentary lifestyle is a major risk factor for developing high blood pressure. Physical inactivity weakens the heart muscle, making it less efficient at pumping blood, which increases resistance in the arteries and leads to elevated pressure. When you sit or lie down for prolonged periods each day, your circulation slows, metabolism drops, and excess calories are more likely to turn into body fat. Increased body weight puts additional strain on the heart, while lack of movement allows stress hormones and cholesterol levels to rise unchecked. Even short bursts of activity, like taking a walk after meals or standing up every hour, can boost circulation and lower blood pressure. Regular exercise not only strengthens the cardiovascular system, but also helps the body manage insulin, reduce inflammation, and improve mood. 10. The role of hydration in blood pressure control. Staying properly hydrated plays a crucial role in maintaining healthy blood pressure levels. Water helps the kidneys function effectively, which in turn regulates the amount of sodium and fluid in the bloodstream. When you are dehydrated, your blood becomes thicker and more concentrated, making it harder for the heart to pump and increasing pressure on the arterial walls. Chronic dehydration can signal the release of vasopressin, a hormone that causes blood vessels to constrict, raising blood pressure. Drinking enough water supports natural detoxification, keeping sodium levels balanced and reducing water retention. Many people mistakenly drink sugary drinks or caffeine throughout the day, thinking they're hydrating, but these can actually contribute to dehydration and raise blood pressure. Water is the best option for hydration, and herbal teas or water-rich fruits like cucumbers, watermelon, and oranges also support fluid balance. Managing your blood pressure is a lifelong commitment, but with the right knowledge and habits, it's entirely achievable. Which prevention strategy are you planning to implement first? Share your thoughts in the comments below. And if you found this video helpful, Hit the like button and subscribe for more tips on maintaining a healthy lifestyle. Stay tuned for more ways to take control of your health.